Alright, so we're going to be talking about skeletal muscles and their functional groups today. So there's going to be a couple different ways we can group these. First off, they could be grouped as prime movers, antagonists, synergists, or fixators. So prime mover is going to be a muscle that will do a primary action. It will be the main muscle responsible for moving a specific bone. An antagonist, think of somebody who's going to antagonize you or upset you or go against you in every which way. So those will be muscles that will oppose the prime mover. And then the next one, like we said, synergists. Synergists are going to be helping out. So when you have synergy with someone, you work well together. So the synergist will help the prime mover or reduce the effects of the antagonist. And then the last one is a fixator. A fixator is going to be a synergist, but the big function of it is going to be to actually hold a bone in place so the joint can move smoother. When we're naming these muscles, we can name them based on their location, their shape, the size, the direction that the muscle fibers are running, the number of origins or insertions they have. So the best example with those would be like your biceps. The biceps have two origins. Sorry, they have they have two origins and one insertion. Okay, the locations of their attachments. So we can name it off of the bony process they insert into, or we can name it off of if it's medial or lateral, or if it's in front of the joint, we can name it off of stuff like that. And then the last one we're going to get into is action. So is the muscle a flexor or is it extensor? Is it an abductor or adductor? Stuff like that. So with the arrangement of the muscle fibers, they can be circular. Let's go to the next slide. They can be circular. When you get circular muscles, you'll get the name orbicularis usually with it. So when I think circular, I think orbicularis oris, which is around the mouth, or orbicularis oculi, which is around the eye. There can be convergent, where we have a broad origin, and it comes into a small single insertion, with the pec is a good example. They can be parallel, so it's going to be a long strap-like muscle, we usually call these. This muscle is the sartorius. We call it the strap muscle of the thigh. They can be unipennate, so all the fibers are going to be running obliquely to a tendon that will be coursing the muscle fiber. They could be multipennate, so you would just take a couple of these unipennate guys and stick them together. That would a good example. That would be your deltoid. They could be fusiform, so that would be taking two heads and putting them together. Or they could be bipennate, so you take two of these unipennates and you stick them together into one.
How you doing? Good. How are you? Thanks.
So when these muscles are working, the way they're going to work is they're going to be basically levers over a pulley or some sort of a pivot. With our lever systems, we're going to have different things. We'll have a lever, which would be a rigid bar, which is going to be your bone. You'll have effort that will be supplied by the muscle contracting, and you'll have a load, whatever body tissue you're moving or whatever object is in that tissue that you're picking up or trying to move with it. So let's check out these different types of levers. First one, we're going to have a first-class lever. The best example of a first-class lever is going to be your head. So let's say I want to be sitting up straight and I want to lift my head up and I want to lift my chin. So I would be using a first-class lever. I'd have a pivot here that would be my axis on my occiput. Okay, and the load would be gravity trying to pull my chin down, and the effector would be my trapezius muscle right here, lifting my chin up. Next one would be another example of a first-class lever. In this picture right here, you can see basically the way the scissors work. So this is our stable bar. Alright, we have a load. Okay, or even easier, you could do a teeter-totter. Okay, next one will be a second-class lever. The best example that the book likes to use here is going to be your calf muscles for you to go onto your tippy toes. So they will pass through your heel and they will insert down into your foot. Here, the example that I like the best is a wheelbarrow. You put the load in the wheelbarrow, the fulcrum is at one end and your effort is at the opposite end. For a third class lever, it will be something similar to that, but here, let's check this out. So you see here how the load and the effector are, and the effort, sorry, let me use my pointer. You see here how the load and the effort are here. Now let's look at the third class lever. The load and the effort are going up in the middle. So for the third class lever, our effort's coming up through the middle of the fulcrum. With a second class lever, the effort is going up through the end of the fulcrum. So an example of the third class lever would be your biceps. They're going to insert somewhere, not at the very end of your forearm, but more kind of a little bit towards midline. So we're going to go through our major muscle groups of the body now. They're going to be grouped based off their location and function. Okay, and there will be, what I'm going to want you guys to know about them is what it's called, what it does, its origin and insertion, and I'm going to want you to know the general innervation. So that's going to be the major nerve that's going to innervate and activate that muscle. I have a list with some of the muscles and nerves and their actions and origins and insertions that I'll post online for you guys. Okay, so first ones we're going to go to is the head. You're going to have two groups, muscles of facial expression and muscles of mastication. So facial expression, that's how we're going to change the way our face looks. That will help out with talking, and we'll also have muscles of mastication, so that can help with talking too. So with our muscles of facial expression, we'll have our corrugator supercilii. That'll be helping with our movement of our eyebrows. We have that orbicularis oculi that I talked about, so when you close your eye and you really burrow or furrow your eyebrow and you try to shut it tight, that orbicularis oris is going to close in a circular motion. We'll have our zygomaticus major and minor muscles here. The major is always going to hold up its minor. So the major is the big one, the minor is the little one. Those will help with lifting your mouth superior and laterally. Okay, you get this little muscle here called your risorius, so that'll help pull your mouth posterior in this direction. We get our depressor anguli oris, so that's going to depress your lips on an angle. We get our depressor labia inferior, so that'll just pull it straight down. Okay, looking more here, this muscle right here is named our temporalis. Why? It's sitting right on top of the temporal bone. And if you watch, the tendon of it is going to pass underneath the zygomatic arch. When you see people chewing gum and you see a muscle sticking out in the side of their head, this is that muscle that's sticking out in the side of their head. Okay, we have our epicranius muscle. This is going to have two bellies connected by a tendon. So the tendon is called the galea aponeurosis, and then we're going to have the frontal and the occipital belly. Frontal belly is because it's over the frontal bone. Occipital belly is going to be because it's over the occipital bone. These are all going to be innervated by your facial nerve. So that's cranial nerve 7. Okay, here's a larger picture. A nice way to start to remember these guys is going to be to check it out. You could get this picture off of myanp.com and download it without any markings on it, or cover all these guys up with some Post-its and lift them up so you can be just constantly quizzing yourself on, because they take a little bit of time to pick up on. Okay, our muscles of mastication. We're going to have prime movers, and our prime movers are going to be our temporalis and our masseter. So here's the temporalis, up and down. This one's going to pull the mandible up, and then our masseter, that's also going to help with pulling the mandible up and anterior. Next one, we will have our grinders. Okay, so that'll help out with medial and lateral movements. These are going to be our medial and lateral pterygoid muscles. The way you get those is you have to put your finger in your mouth. If you're traveling along your cheek, you go straight back until you feel something that's tender. Those are going to be your pterygoid muscles. And with the tongue, here's our tongue muscles. These help out our tongue movement. Okay, muscles of our anterior neck. So, muscles of our anterior neck, we'll start off with we'll have a bunch of muscles. First off, let's say going off of our hyoid bone. If you remember back from the skeletal system lecture, that the hyoid bone is the only bone in the body that doesn't articulate with another bone. It is just floating. It is going to be held in place by a series of muscles. So check out all these muscles we talk about. We talk about the stylohyoid, okay? So that's going to be coming from the styloid process, and it's going to be going into the hyoid bone. We have thyrohyoid, so that's going to be coming from the thyroid cartilage into the hyoid bone. Sternohyoid, we go from the sternum into the hyoid bone. You're catching on to a pattern here. These guys all come into the hyoid bone, and they're going named off of what they're coming from to what they're inserting into. Omohyoid, it's going to be right here. Alright, here's our sternohyoid on the other side. Okay, and above it, we're going to have our mylohyoid, which is this big thick muscle, and the stylohyoid again.
Hey, young.
Okay, so these deep muscles of the anterior cervical spine or anterior neck and throat, the big thing for these are going to help with flexion, but even more importantly, they're going to help with swallowing. So we said our hyoid bone acts as an anchor for all these muscles, and it assisted in swallowing action. Alright, so we had groupings. All the muscles that are above the hyoid bone, we refer to those as our suprahyoid muscles. All of the muscles that are below the hyoid bone are called the infrahyoid muscles. So our suprahyoid muscles, to restate, would be our stylohyoid, our mylohyoid, and our digastric muscles. The digastric, there's going to be an anterior and posterior belly. Anterior belly is in front, posterior belly is going to be in back. Their infrahyoid muscles, those will be the strap muscles. So the strap muscles are going to include the sternohyoid, this guy right here, the omohyoid, which is this guy right here, the sternothyroid, which will be the inferior portion of this muscle belly, right? The thyrohyoid, which will be here. Alright, and then our pharyngeal constrictors. I don't think we have our pharyngeal constrictors on this picture. Okay, with the muscles of the vertebral column, these guys are going to be the ones that are going to help out more with movement. We're going to have two groups, okay? But let's first talk about this sternocleidomastoid. I refer to this usually in class as the SEM. The function of this muscle will be flexion of the head and rotation. We have our scalenes. These are going to help out with lateral flexion, and these will also help out with deep breathing. So if you're huffing and puffing, these guys will help to lift the first and second ribs. In smokers, these muscles are typically overdeveloped, and you'll see them kind of sticking out. And if you feel them, if you are a smoker, you can dig in on where you see the location of these muscles are, and they'll be real tender. Because every time you try to take a drag from a cigarette, you fire these muscles, and it makes them get into a state of tense or hypertonicity. So here's our middle scalenes, here's our posterior scalenes, and here's our anterior scalenes. So we have three groupings. Alright, SEM, sternocleidomastoid, that'll be our major flexor, okay? It'll help out with lateral head movements, it'll help out with flexion, and it'll help out with rotation of the head. Alright, looking at the posterior spine now, we're going to have different groupings of muscles. We have our erector spinae. Alright, within your erector spinae, they're going to be broken up into our spinalis, our longissimus, and our iliocostalis. I like to remember, I love spaghetti. That's how I remember them. So we have our spinalis is this innermost group. We have our longissimus is the middle group, and then we have the iliocostalis is the most lateral grouping of muscles. These guys can help out with lateral flexion and extension. If you notice, they're going to be very, very large muscle groups, and they'll be there for broad movements. Then next one we get here, this is called the quadratus lumborum. It's named because it has 4 sides and is kind of square shaped and is found in the low back. Here is the ligamentum nuchae. This is on your structures list of stuff to know. This is going to prevent your head from flexing too far anteriorly, and a lot of times people have a hard time finding it, so I'm just pointing it out there for you. Okay, so muscles of the thorax. Your intercostal muscles. You're going to have an internal group, and you're going to have an external group. The external group the fibers of it will be oblique to the internal group. So our external group here, if you see the way these anchor, they're going to lift our ribs up and out. So that's going to help us inspire or bring air in. The internal group, the fibers will be angled down and in, so that's going to help us with forced expiration. Our next major muscle for breathing, which will be the primary breathing muscle, will be your diaphragm. This is going to be very, very important for us to breathe. When you see people and they're breathing properly, if their diaphragm's working, their diaphragm will relax, and that will allow the lungs to recoil because they have elastic tissue, and that will force air out. When you breathe in, the diaphragm flattens out, and that pushes your belly out. So let me show you. Let me draw a little picture here for you. So at a resting state, the diaphragm is shaped like this. Okay, your chest is up here, the stomach and abdomen is down here. When that diaphragm contracts, it pushes downwards, and what that'll do is that'll increase the amount of space inside the thorax, and that will drop the pressure and cause air to flow in. When it relaxes, that moves back up, the lungs can recoil, and we will have air moving out. Your diaphragm is going to be innervated by the phrenic nerve, okay? And like I said, when you breathe in, this moves down, so what it does is it forces you to push your belly out. And then when you breathe out, it relaxes and your belly gets sucked back in. So when you hear about singers and they want them to be belly breathers, this is what they're talking about, is breathing with your diaphragm, not with your intercostal muscles. Okay, muscles of our abdomen. We're going to have a couple different groups. We'll have your rectus abdominis, so that's what, when you see the rectus abdominis, that's when you think of somebody having a six-pack. That's what's there. Next one, we're going to have internal and external oblique muscles. So those fibers will be running obliquely and they will be on your sides. External layer will be on the outside, internal layer will be on the inside. Then the last one is your transverse abdominis. Transverse abdominis is basically a corset that's going to be that'll start off at your spine and wrap around and act like a corset around your belly. With your abdominal wall, once again, looking at a side view, so here's those external obliques. They're running on a nice angle. Alright, here's the internal obliques. And then we get that transverse. Like I said, it's gonna be like a corset wrapped around front to back. So the major functions for these guys will be to hold in your stomach. They'll help with defecation, urination, childbirthing, coughing, and if you're going through heavy breathing type activities. So next one we're going to hit is our pelvic diaphragm. This is going to be to separate your pelvic organs from the outside world and keep everything in. These are going to seal the inferior outlet of the pelvis. They're going to support the pelvic organs, like I said, hold them all in. It's going to help lift the pelvic floor for defecation, and it's going to increase intra-abdominal pressure.
So continuing on, the perineum. The perineum will be inferior to the pelvic floor. It will form your urogenital diaphragm and your external urethral sphincter. So your conscious control of urination will be through your pelvic floor. When women give birth, baby has to pass through the pelvic diaphragm and the perineum, and that gets stretched out and beaten up, and after giving birth, women should do Kegels to strengthen this back up and to protect their control of urination. So that's a nice thing that a lot of times gets overlooked by an OB. Okay, superficial muscles of the thorax. Most of them are going to be your extrinsic shoulder muscles. The function of them is going to be to fixate and protect your shoulder girdle. You're going to want to allow the shoulder to have lots of range of motion, but at the same time we're going to need to be able to protect it and prevent it from moving too far or causing damage. Their actions will be elevation, depression, rotation, lateral and medial movements, and then our protraction and retraction. They'll be broken up into two main groups: the anterior thoracic and shoulder muscles and the posterior thoracic muscles. So let's check out our anterior muscles. The anterior muscles are our pectoralis minor, which we're going to see here, your serratus anterior, which are, if you ever see somebody who's like totally ripped and they're like a bodybuilder guy and they look like they have these worm-like projections coming out underneath of their arm on their ribs, that's those. And your subclavius, which is very, very hard to see. The pec major, lots of people think that it is a superficial thoracic muscle, but we'll talk more about that when we get into the humerus and motions of the humerus. Our posterior thoracic muscles, that will be our trapezius, named for shape. It is trapezoidal in shape. There are two parts to it. There is the upper trap and there is the lower trap. Alright. We have our rhomboid muscles. So we have our rhomboid minor and our rhomboid major. You might have heard me say earlier, the major always holds up as minor. Major's big, minor's small. Here we have our infraspinatus. It's below the spine of the scapula. So it's infraspinatus. Above the spine of the scapula we have our supraspinatus. Alright, we got our levator scapula. These aren't superficial thoracic muscles, the infra and supraspinatus. But we got our levator scapula, and like I said, rhomboid minor, rhomboid major. Once again, we'll talk about the latissimus when we are talking about the humerus. So our muscles for the shoulder, we're going to have our deltoid, alright, pectoralis major, that will be crossing the shoulder into the humerus. And you'll have your coracobrachialis. It goes from your coracoid process up here into your brachialis. Some of the muscles come off of the axial skeleton, some of the muscles are going to come off of the spine, but the three major movers are going to be your pec major, which we saw here, your deltoid, and your latissimus back here. I went back a slide. The functions of these are going to be flexion, extension, adduction, so pulling the arm away from your body, and abduction, pulling the arm into the body. Okay, so more muscles. We're going to talk about your rotator cuff or your sits muscles. So supraspinatus, infraspinatus, teres minor, and subscapularis. So let's go through it. Here's our supraspinatus. Here's your infraspinatus, and you see they're all coming around into the front of the humerus here. Here's your teres major. Sorry, teres minor, and here's the teres major. Major always holds up the minor. Alright, these guys all work together to fixate the humeral head and to protect it. Two other muscles are going to help out with these are going to be our teres major and our coracobrachialis. Alright, so let's talk about the shoulder actions. Going through muscle by muscle, it pretty much just here's the actions that they do. Your pec major, it will help out with flexion and adduction, so it brings your arm, it flexes it, it brings it in front of your body, and it brings it towards midline, and it can medially rotate. Latissimus dorsi, imagine reaching for your wallet, so you reach back and out. Or grabbing a baton if you're running in a relay race. It can do some medial rotation. Okay. Teres major, it's not going to be a prime mover. This PM stands for prime mover. It's not going to be the prime mover for anything, but it's going to help out with extension, adduction, and medial rotation. So it'll just be a 100% helper for the latissimus. Your deltoids, your deltoids are broken into anterior and posterior fibers. The anterior fibers are going to do flexion and medial rotation. The posterior fibers do the opposite. They're going to do extension and lateral rotation. Your subscapularis is going to help out with medial rotation. Your supraspinatus is going to help out with abduction. Your infraspinatus will do lateral rotation. And your teres minor is going to be another primary mover for lateral rotation. Teres minor and infraspinatus share responsibility there, 50-50 I'd say. Coracobrachialis, that guy's going to be there as a helper once again for flexion and abduction. And then our triceps brachii are going to help out with our adduction. Okay, so let's talk about our muscles crossing the elbow here. So we're going to have our triceps brachii. We'll have a long head, we'll have the long head, which is over here. We'll have the medial head, and we'll have the lateral head. Here's your biceps brachii. Here's your brachialis, which is sitting below or inferior deep to the biceps brachii, and then you get your brachioradialis, which is this guy right here. Moving in a little to the next one, crossing the elbow joint, you're going to have your triceps. So here's your long head of the triceps. Here's the lateral head of the triceps. You don't get a good view of the middle head here, or medial head. And this guy right here is the anconeus. Anconeus is going to help with locking and unlocking of the elbow. So next one we go into is your forearm. Your forearm muscles are going to be there to help move the wrist, the hand, and the fingers. The anterior muscles are your flexors, and the posterior muscles are your extensors. So if you're sitting in anatomical neutral, in the front part, those are your flexors. Posterior is going to be your extensors. The muscles in your forearm are going to be the muscles responsible, major muscles responsible for strong motions in your hand. They'll also be responsible for pronation and supination. Pronation, bring your palm up. Sup, please. You want to hold the tray. Supination, supination, hold your hand up. Sup, please. Have palm up. Pronation will bring palm down. Okay, so with our forearm, once again, the anterior will be our flexors and pronators. The posterior will be the extensors and supinators. Flexors will come off of our medial epicondyle. Extensors will come off of our lateral epicondyle. So here is our medial epicondyle. You remember we said all of our flexors come off of the medial. So here's our medial epicondyle. We're going to have our flexor carpi radialis. So flex is your carpals. That's coming off of the radius. You're going to have your palmaris longus, which goes right into the middle of the palm. Another name for this is a freshman nerve, because a lot of first-year med students mistaken this for a nerve. And then you get your flexor carpi ulnaris. So flexor carpi radialis goes off to the radial side. Flexor carpi ulnaris stays here on the ulnar side. And then deepest one here is the pronator teres. So that will help out with pronation. Okay, deeper muscles of the forearm. We'll have our flexor digitorum profundus. This is a big honking muscle. This is going to help with strong flexion of the hands. Alright, and then we're going to get our flexor pollicis longus. Okay, you see it right here. Here's our flexor pollicis longus. And then we'll get our pronator quadratus, which is this guy right here. It goes straight across. It's not coming from a medial or lateral epicondyle. Okay, superficial posterior forearm. We're gonna have our we're gonna be coming off over here. All right. So first off, we get our extensor digitorum. We get our extensor carpi ulnaris. So we're gonna be going off to the ulnar side. And we're gonna get our extensor carpi radialis. There's a brevis and there's a longus. So let's start off with the longus. Here's the longus. Oops. Here's the longus. And here's the brevis. Longus is traveling a longer distance, so it goes by the longus. Alright, here's our deeper layer. So you'll have your extensor indices, this is to point. You'll have your extensor pollicis longus, so this is going to help with thumbs up. You're going to have your extensor pollicis brevis. Alright, and then we'll have our abductor pollicis longus. So this is going to help pull your thumb away. Okay, with the intrinsic muscles of our hands, these will help with fine movements, and these will lie in between the bones in the hands, and these will not be very strong, but these will give us, like I said, these will give us our nimble movements and fine movements of our hand. So first off, let's talk about these lumbricals. These are lumbricals. Okay? These are lumbricals. We are looking at a superficial layer of hand muscles, okay? Flexors, so we're looking at the palmar surface of the hand. So these are our lumbricals. You get your fourth lumbricals, your third lumbrical, your second lumbrical, okay? We're going to have our abductor pollicis brevis. We have our opponens pollicis, so this is going to help with opposition, so bringing the thumb to the pinky. We have your adductor pollicis right here, so this is going to help pull your thumb away from midline, pull your thumb away from the rest of your hand. Okay, we have our flexor pollicis brevis, so this is going to help with flexion of the hand. You get flexor digiti minimi, which helps flex the pinky, and abductor digiti minimi, which helps pull the pinky away from midline. Alright, here's your interossei, so these are going to be between your metacarpals. You see them? So those are the dorsal interossei. Here are the palmar interossei. Okay. Next we're working our way into the leg. So we're going to have anterior muscles. Those will help with flexing of the femur and the hip. Posterior muscles will help with extension of the thigh and flexion of the leg. Okay, all three groups are going to be enclosed by our fascia lata. So here we're looking at an anterior picture here. This guy is our quadratus lumborum. This guy right here is your psoas muscle. Sorry, this is your psoas muscle. Psoas major, psoas minor. Your iliacus muscle is in here. So iliopsoas, that is the filet mignon. If you eat steak, filet comes from the iliopsoas. This guy right here is our sartorius. This is called the strap muscle, or it's a strap muscle. We're going to look at our pectineus in here, adductor longus, gracilis, and adductor magnus. Those guys are kind of hidden back there. Here's our rectus femoris, vastus lateralis, it's a big muscle and it's lateral, and vastus medialis, it's a big muscle and it's medial. Here's your tensor fascia lata, TFL. So muscles of the thigh, big thing that they're going to do: flexion, extension, abduction, circumduction, so you can bring your arm around in a circle and you can rotate it also. These guys are going to pass in front of the flexors will pass in front of the hip. The extensors will pass posterior to the hip. Like I said, your iliopsoas is going to be the main muscle of flexion. That is your filet mignon. So the filet gives you flexion. Tensor fascia lata and rectus femoris, these guys will help out, but the main mover is this iliopsoas. Okay, next one we have our adductors. So we have our adductor magnus, which is this big guy, the adductor longus, which is a little longer, and the adductor brevis. Coming up, we had the pectineus, which would have went from here to here. And we have our gracilis, which we have to come back to this slide, but here's the gracilis. So on this slide, the gracilis would have went from here to here. Okay, with our thigh extensors, you're going to have your semi-membranosus and semi-tendinosus. Here's your semi-tendinosus right here. Alright. Here's your semi-membranosus. It's going to come. It's going to get hidden now by the long head of the biceps femoris. All right. Semimembranosus and tendinosus. Think of the tendinosus as a hot dog and the membranosus as a hot dog bun. Glute max, that is going to be the strongest extensor of the hip. That is the prime mover of the hip to extend. Biceps femoris, there's going to be a long head and a short head. Those are your hamstrings, are going to be our semimembranosus, tendinosus, and biceps. Tendon looks like a hot dog. Membranosus looks like the bun, with the hot dog sitting in it. Okay, so abductors and rotators. We're going to have our glute max, which is cut here. Alright, glute max is cut. We're going to have our glute medius, which is also going to be cut here. That one's going to be a medial rotator. We're going to have a glute minimus, which will also be a medial rotator. So if anybody has really tight glute minimus and glute max, if you ever look at them, you see those people, I describe it as they're like walking with their toes turned out, like Barney Rubble or Fred Flintstone, how his toes are turned out. These muscles are overactive. They need to get stretched out and they need to relax. Another muscle in here that's going to help out is going to be the piriformis. Alright, piriformis is going to be, these guys, glute medius and glute minimus, are going to be the ones that will make you pigeon-toed. I misspoke there. Glute medius and glute minimus will make you pigeon-toed. Those will turn you in. When you have your foot turned out, the muscles that are going to be overactive are going to be your glute max and your piriformis. Those will be the big ones. Obturator internus and externus, which are these muscles here. Here's your obturator internus. Here's your obturator externus. Right here, it just peeks out a little bit. Those guys are going to also help with it, but the ones that get really overactive and tight and cause issues are your glute max and your piriformis. And then your gemelli. Those guys also help with that external rotation. Okay, muscles are going to be moving the knee. The big ones are going to be your quadriceps and your hamstrings. Alright? With your quadriceps, you're going to have your rectus femoris. You're going to have your vastus lateralis and your vastus medialis. These will help out with extension. Your vastus medialis will have this special grouping of fibers right here called the vastus medialis oblique fibers, and those will help with locking the knee out completely. Okay, with movements of our leg, you can have dorsiflexion or plantar flexion. So plantar flexion is pushing on the gas, dorsiflexion is lifting your toes off of the ground. With your intertarsal joints, you can have inversion or eversion. Inversion is going to be flattening the arch of your foot, turning your foot inwards. Eversion will be trying to roll your foot outwards and lifting the arch of your foot. With your toes, you can flex them or extend them. When you curl up your toes, you are flexing them. When you separate them and open them up as wide as you can, you are extending them. Okay, let's look at our anterior compartment of our leg. These guys are mostly going to be responsible for extension and dorsiflexion. So let's start going through these. Here's our tibialis anterior. Here's your extensor digitorum longus. Working our way down here, this is called extensor hallucis longus. The way people remember these are Tom, Dick, and Harry. Tom, Dick, and Harry is the tibialis anterior, the extensor digitorum, and the extensor hallucis longus. Then working our way a little bit lower here is the fibulas tertius. So it comes off of the fibula. Okay. Looking again, we have our muscles of our lateral compartment of our leg. We want the fibularis longus, which is right here, and the fibularis brevis. If you see the name peroneus, sometimes fibularis gets replaced by it. So when I'm thinking in my head right now, is peroneus longus and peroneus brevis. Okay, I don't think of them as the fibularis muscles. I think of them as the peroneus muscles. Alright, muscles of the posterior compartment. Here's our superficial muscles. So we'll have our gastrocnemius, your big calf muscle, and there will be a medial head and a lateral head, and just inferior to that you'll have this guy right here, which is your soleus. Alright, we cut away that gastroc muscle and we have our soleus cut away too. Underneath of it is going to be the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. Okay, this little muscle right here courses through the back of your knee. It's called the popliteus. This is going to be responsible for unlocking the knee. Intrinsic muscles of the foot. Okay, these guys are going to help flex, extend, abduct, and adduct your toes. So let's look here. So on our superficial layer, we're going to have our flexor digitorum brevis, which are these guys right here. Our next layer we have in are going to be our flexor accessorius, which will be just inferior, which will be just deep to these. It's hidden here. And then our deepest layer, you're going to have your flexor hallucis brevis, which we can see right here. Hallucis is your big toe. If I didn't mention it earlier, your pollicis is your thumb, your hallucis is your big toe. Pollicis is thumb. So hallux is your big toe. So flexor hallucis brevis is the short flexor of the big toe. Adductor hallucis, alright? We don't have a good picture of the adductor, but we have a good picture of the abductor hallucis right here. It's going to come in, insert here, and pull the toe out that way. And then the flexor digiti minimi brevis. That's going to be this guy right here. Flexes the little toe, and it's a short little muscle. And then the deepest layer will be your flexor, your plantar and dorsal interossei. Alright, take care.